How does a healthcare team deliver a brief intervention following a positive screen result? So your clinic is implementing alcohol screenings. This is an important step in providing whole-person care. This is the third video in a 4-part series to help your practice improve health outcomes and destigmatize behavioral health issues. We know your practices are busy and unique. Every day is different. What's important is that regardless of the day, there is a standard process in place to deliver consistent, quality care to every patient. Here's what you'll learn in this video. A brief intervention is a structured conversation designed to invite the patient to consider their alcohol use and explore possible lifestyle changes. A variety of professionals could have this conversation with the patient. This conversation should be brief. Best practices for this conversation include utilizing a motivational interviewing approach. Handling a brief intervention appropriately is the right thing to do in providing whole-person care. So what is a brief intervention? A brief intervention is the exchange between a health professional and a patient whose screen result indicates they are drinking above the low-risk guidelines. They may have some negative consequences, but are not showing signs of a serious disorder or alcohol dependence. The main objective is to have a conversation with the patient that encourages them to consider the potential negative impacts of their current alcohol use and how making some behavioral or lifestyle changes might improve their overall health. There are a number of different people at your clinic who could handle this conversation. It could be the provider, a nurse, a health educator or care coordinator, or even a behavioral health specialist. It should be brief. Keep the conversation between 7 and 15 minutes. You might want to use a visual tool that helps the patient understand the guidelines for low-risk alcohol use. Also, try using motivational interviewing techniques. Motivational interviewing goes beyond simply offering your patient advice and information. It is a communication style that helps motivate and empower people to make behavior changes. It allows them to reflect on their lifestyle and habits and come up with their own ideas to improve their health. They are in charge. Research shows this is more successful than advice alone. There are many models for brief interventions. One straightforward model is FLO. FLOW stands for feedback, listen and understand, and explore options. This model is very compatible with motivational interviewing. Conclude the conversation based on the patient's feedback. You might remind them of the low-risk drinking guidelines. Share resources like the Rethinking Drinking website from the National Institute on Alcohol Abuse and Alcoholism. Schedule a follow-up appointment or check-in call. Express support and encouragement for any reduction or behavior change. Offer a referral if necessary. There are many additional resources available to support further learning about motivational interviewing, as well as tools to help normalize and destigmatize the topic of alcohol use. We encourage you to explore them. It will help you have more effective conversations with your patients. Let's review what we've covered. A brief intervention is a structured conversation designed to invite the patient to consider their alcohol use and explore possible lifestyle changes. A variety of professionals could have this conversation with the patient. This conversation should be brief. Best practices for this conversation include utilizing a motivational interviewing approach. Handling a brief intervention appropriately is the right thing to do in providing whole-person care. In the next video of this series, you'll learn how a healthcare team can manage the referral process when a screen indicates that a patient is at high risk from their alcohol use. When you put this into practice, you could change a life.